So today our topic is hospital. Hospital is a topic from Fundamental of Nursing, and it's very general topic. But in the competitive exam, they should ask some simple questions, which is create the well-known error mistake during the answer. So, what special points included in the hospital chapter? Let me discuss. First, in the hospital chapter, the meaning of hospital is very important. So, hospital can be defined as a organized institution for care of sick and injured. So, hospital is nothing but it's a organized institutions which helps to care the sick and injured. It's a comprehensive question. So they may ask like the character statement, define the character statement of a hospital. In that we should recognize the statement is nothing but hospital is a organized institutions for care of sick and injured. So this is one of the comprehensive questions which should be asked in the competitive exam. So let me discuss the hospital meaning, right? So the hospital, this hospital word is derived from Latin. Hospital word derived from Latin. So in the Latin, the word called as hospice. Hospice is the word in the Latin which means hospital. So this hospice meaning is host. So hospital basically derived from the word of host. See, this host in Latin language called as hospice. So this hospice with the word helps to denote the hospital. So here they may ask a question like hospital, the word derived from Latin. Hospital, hospice is the word which denote hospital, and meaning of hospital is host. So these are the questions which may they ask. Coming to the next, the classification of hospital. In the classification of hospital. Okay, coming to the classification of hospital. In the classification of hospital, they should ask majorly the classification based on the bed strength. Bed strength. Here there are different types of hospital. First of all, small sized hospitals. So small sized hospitals bed capacity is 100 bedded or less than 100 bedded hospital called as a small sized hospitals, and medium sized hospitals called as 101 to 300 bedded capacity. 101 to 300 bedded capacity hospital called as medium sized hospital, and a large sized hospital 301 bedded capacity to 1000 bedded capacity hospital called as a large bedded hospital. So like this, three different type of hospitals based on their bed capacity. And here some other classification can be done in the first teaching hospital. Teaching hospital. So teaching hospital bed capacity is 500 bedded hospital. So based on the student strength, they may enhance this 500 bedded hospital, but the minimum strength for the teaching hospital, this we called as a regional hospital also. So regional hospital or teaching hospital minimum bed capacity is 500 bedded hospital. And here the district hospitals. So district hospitals bed capacity. District hospital bed capacity is 200 bedded hospital. 200 bedded hospital is a district hospital. And coming to the taluk hospital. So in taluk hospital, the bed capacity is taluk hospital is a 50 bedded capacity hospital. 50 bedded capacity hospital. And coming to the, so maybe it's not appearing. So I'm writing here district hospital. District hospital capacity is here 200 bedded capacity. And coming to the Taluk Hospital, 50 bedded capacity. And coming to the community health centers, 30 bedded capacity. It's very important. Here, community health centers bed capacity is very important. So please note down this. And coming to the PHC, also very important. PHC bedded capacity is 6 bedded hospital. 6 bedded hospital. They may enhance up to 10. So here 6 to 10 and 30 to 50. This is the enhancement of the bed capacity. So these two are very important. Community health center hospitals are established with 30 bedded capacity, and PHC centers are established with 6 bedded capacity. So these are the different type of hospitals based on the bed capacity. Right. Next, in the hospital setup, we should provide different types of care, especially the nursing care. So in the hospital, most of the nursing care is curative, preventive, promotive. So these are the main areas. First, curative, the illness, then promoting of the health, and the preventing of the diseases. Along with that, we should provide a rehabilitative care and nursing education. So these are the different types of areas which we have to provide. In that, one special care which we call as a hospice. So this word is very important. This word is hospice, Hospice. But here just now I explained that word called as a hospice. See, these two words are similar, but here just differentiate the meaning here. Hospice is a Latin word which meaning is hospital, right? So, and here this word is a hospice. The meaning of this word is nothing but here care of a dying client. So, which the nurse is providing the care for the dying client, especially in the cancer patient. So the care which we have to provide the cancer patient, that is called as a hospice care. In the end stage of cancer patient, we should provide this type of services, and in this type of services only we should give palliative and supportive care only. So here we should give the palliative and the supportive care only, right? But we should not give the, especially not give the curative. Here we should provide palliative and the supportive care, but we should not give the curative, because of here you just remember that the cancer is at the last stage. As you know that there is no curative procedures, right? Only supportive and the palliative therapy only we have to provide. So if the nurse is providing a palliative and the supportive care to the client before to approach the death, that we call as a hospice. So hospice is a very famous word which we have to provide the services at the home and at hospital setup also, right? So here just care. Remember 3 areas. Care is nothing but here only we have to provide supportive care and palliative care, right? So, but not provide the curative. Here we should not provide the curative. And the nursing services in this case is you just remember that we have to alleviate the pain, especially keep the patient free from the pains and to comfort the patient as possible. And here just remember that mostly we should help the client to meet primary wishes. So here in the part of hospice, we should help the patient to meet the primary wishes. So in the hospice care, you just remember that we should assist the patient psychologically, physiologically, and spiritually. We should solve the problems and offering the voluntary services to meet the need. So this is what the hospice care. This is about the hospice. You just remember they may ask one question. Next, we should discuss regarding the hospital departments. In the hospital departments, there are the different type of departments we can observe. In that, first, you just remember that outpatient department. See, this outpatient department, especially investigative and the curative work can be done. In the investigation and the curative work can be done in outpatient department. So in outpatient department, especially we should observe like consultation services, health promotion services, health preventive services, rehabilitative services, health education services. These are the some special services can observe in outpatient department. So from the outpatient department, we experience some questions. So in that, first you just remember that a patient is approaching the hospital for the physiotherapy. As a nurse, suggest the department. In option, we observe OPD, IPD, OT and any other departments. So here, for the physiotherapy, it's a rehabilitative department. So rehabilitative departments comes under the OPD. So that you should remember. And if the patient is approaching the hospital for the occupation therapy, as a nurse, please suggest the department. So here occupational therapy is a rehabilitative therapy. So rehabilitative therapy comes under the OPD. So like that, from the OPD department, there are different type of comprehensive questions may come in the competitive exams. Coming to the next department called as a inpatient department. So in IPD department, all type of services can be done. So that's why here this IPD, inpatient department, is the heart of the hospital. So in the inpatient department, they may medical ward, nurses room, and then dietary stations, and all other services also can observe. That's why many dimensional services can be approaching the department called as a IPD department. Coming to the next medical department. See, in the medical department, all type of clinical services, all the clinical services comes under the medical department. So example, medical, surgical, dental, ENT, neurology, obstetrical, gynecology, these all the medical services comes under the medical department, and the medical department head is medical superintendent. So this is about the medical department. Coming to the next nursing department. See, in the nursing department, there is two types of services can be done. One is nursing service, and another one is nursing education. So in nursing department, two areas we observe in the hospital setup. One is the nursing service, which we call as a clinical service of a nurse, and nursing education, which we call as a vocational service. So here in the hospital setup, nursing department include two types of services. Nursing services, which we call as a clinical services. In the clinical services, we should apply the different type of nursing procedures for the curative, promotive and preventive purpose of the patient. At the same time, we should provide nursing education for the vocational training purpose, right? So these two areas can be covered. Coming to the next department, paramedical department. In the paramedical department, especially all pathological services, can be done in the paramedical department, especially bacteriology and biochemistry and serology, hematology, all these type of services can be done in the paramedical department. This paramedical department also attached with the X-ray department. In the X-ray department, all the investigative, so radiational investigative can be done in the X-ray department. So these are the some departments. Then coming to the next department called as a OT, operation theatre. See, operation theatre is a very special department here. In the operation theatre, as you know, there is a separate procedure to service, and here in the operation theatre, there are the 4 zones can be observed. 4 zones. In the first zone we call as a outer zone. First zone called as a outer zone, and then second zone called as a here clean zone, and third zone we call as a sterile zone, and fourth zone we call as a here disposal zone. So here first zone we call as a outer zone. Outer zone is outside the operation theatre, and outside the operation theatre and the rest of the areas we call as a outer zone of OT. And the clean zone is a within operation theatre but outside the operation chamber. Outside the operation chamber within the operation theatre called as a clean zone. In the clean zone we should observe that nursing station, doctor station and other pre-operative services can be provided in the area called as a clean zone. So it's one of the question here. Pre-operative preparation of the client can be done in the OT, that is called as a clean zone. And coming to the sterile zone, we call as a aseptic zone. So aseptic zone is only the zone which has to perform the procedure. In this sterile zone, especially gowning, scrubbing and all other preparational activities can be done in the sterile zone. Here they may ask the question that if the nurse want to scrub before the operation procedure, so in which zone she want to go for sterile or to scrub the hand. So the zone we call as a sterile zone or aseptic zone. Coming to the last one, that is a disposal zone. In the disposal zone, the material which has generated in the operation theatre can be handled in the disposal zone. So these four zones can be observed in the operation theatre. So coming to the next department, there are the other department also observed that pharmacology department and dietary department, as you know that, right? So and here some other departments also can be observed in that non-professional department, non-professional services. So is non-professional NPS services or especially administrative, billing, accounting and all other services can be done in the department called as a non-professional service department. Coming to the one important department that is a CSSD. CSSD here is nothing but a Central Sterile Supply Department. So here this department can handle all the sterile articles which has to supply for certain procedures, and at the same time CSSD also handle some disposal which has to generate from the operation theatre and the other areas. This department we call as a CSSD, Central Sterile Supplying Department. In the hospital it's very important department, you just remember. One more department called as a MRD. MRD stands for Medical Record. So Medical Record Department, it's a very important department here. So they always statement that people forgot, records remember. So this is the statement of MRD department. In the MRD department, there is a certain criteria in the MRD department, especially to store the outpatient records. Duration is 5 years. To store the inpatient records, duration is 10 years. And here to store the medical legal cases, the duration is 15 years. So this is the duration which we have to store the records. So this is one of the important question from the record and the reporting. That question may comes like the duration to store the outpatient record in the MRD department, 5 years. The duration to store the inpatient record in MRD department, so in MRD, 10 years. To store the MLC record in MRD department, 15 years. So these are the questions they may ask from the MRD department. So these are the some hospital departments which we have to discuss. Thank you for watching this video. Please feedback and subscribe the channel for the more videos. Thank you.